Good morning, everyone, and welcome. I want to take a moment to acknowledge that we are gathered on the unceded traditional territories of the Algonquin Anishinaabe Nation. We are grateful to live and work on this land and come together with humility in the spirit of respect, partnership, and reconciliation. On behalf of the Canadian Chiropractic Association, thank you for joining us today. The CCA represents over 8,000 chiropractors across Canada, all dedicated to helping Canadians move, work, and live pain-free. Our members are experts on the treatment of spine, muscle, nerves, and joints to improve mobility and alleviate pain. Everyday chiropractors diagnose and treat common conditions like back pain, neck pain, headaches, and other joint issues that affect millions of Canadians. We see firsthand, day in and day out, how timely evidence-based care can help reduce the burden on hospitals and ER departments, help people recover faster, get back to work, reduce dependence on opioids and other pain medication, and stay active in their workplaces, communities, and families. Since yesterday, the Canadian Chiropractic Association has been here in Ottawa, meeting with members of Parliament and federal officials to discuss our priorities. We are calling on the government to expand the Canadian Student Loan Forgiveness Program to include chiropractors, which will help improve access to rural and underserved communities. Reinstate chiropractic care under the Non-Insured Health Benefits Program. Authorize chiropractors as assessors for the federal disability tax credit. Remove federal and treatment barriers that limit care for members of the Canadian Armed Forces. This morning, our focus is on the Non-Insured Health Benefits Program. Too many First Nations and Inuit peoples face barriers to accessing chiropractic care. Expanding NIHB coverage is a key step toward health equity, community well-being, and better outcomes for all First Nation peoples. It is now my pleasure to introduce Dr. Jennifer Ward, one of the co-chairs of the Canadian Chiropractic Association Indigenous Chiropractic Caucus. Thank you.
Good morning, everybody. Waliak Sikbuk. Thank you for being here today. Waldasin tan telebegisin, waladet giskuk, walaliok tan telpe dayok. Nina Mikmad, Dalewi Migamagi, Aknin Delawisit, Dr. Jennifer Ward. And I'm here today with my colleague, Dr. David Peeace, and together we serve as the co-chairs of the Indigenous Chiropractic Caucus. We are speaking to you today about an issue that deeply affects the health and well-being of Indigenous peoples across Canada. Equitable access to non-pharmacological care for joint and muscle conditions through the Non-Insured Health Benefits Program. Despite Canada's federal commitments to reconciliation and culturally relevant community-led healthcare, chiropractic care remains excluded from the NIHB program. This exclusion creates barriers for individuals who need safe, effective, and drug-free treatments for their joint and muscle conditions. Ongoing systemic racism in the healthcare system has led many First Nations people to avoid and delay care. It's been resulting in untreated or mismanaged musculoskeletal pain and increased disability. Many report that our pain has been ignored, minimized, and disbelieved, creating a disproportionately high prevalence of joint and muscle disorders and a toxic reliance on opioids. Access to a range of care options is a core component of equitable health care. Every other federal program, from the RCMP to the military to veterans and to their own federal public servants, offers access to chiropractic care. So the federal government clearly recognizes the value of chiropractic care. Yet, the only federal program that does not offer these options is the NIHB program. And I'm here to ask you, why is that? If we are serious about implementing the Truth and Reconciliation Commission's calls to action, specifically 18 through 24, then we need to offer the same standard of joint and muscle conditions as every other federal program. That is equity. So let me share an example of what is possible when that care is available. In 2021, Health Canada funded my research team to establish a chiropractic clinic in Pimichigamak Cree Nation in northern Manitoba. I drive 4 hours each way from Opaskwayak Cree Nation, and I alternate with another chiropractor, Dr. Myers, who flies in from Winnipeg. the community, in partnership with World Spine Care Canada, has established a nonprofit clinic, and we provide care at no cost to the patients. And the impact has been transformative. We have built strong partnerships with the nurses and doctors, and they're a major source of referral for patients. They've told us directly how much our work helps offload their burden of patients with joint and muscle pain, both in the primary care clinic and in the ER department. The numbers of unnecessary x-rays have gone down. The need for patients to leave the community for care has gone down. And the need for prescription pain medications, including opioids, NSAIDs, and Tylenol 3, have all gone down. But most importantly, patients are feeling better. They are missing less time from work, they're more active with their children, and we're able to contribute productively to our communities. But our funding is running out, and without sustainability, this vital service is at risk. This story is not unique. Across Indigenous communities, access to chiropractic care remains a significant barrier, and it's time to change that. Reinstating chiropractic coverage under the NIHB program is not just a policy decision. It's a reconciliatory action that is grounded in upholding best practices. It's about providing equitable, culturally safe, and community-driven healthcare. It's about recognizing and respecting the rights of Indigenous peoples to access the full spectrum of care, evidence-based, that is congruent and recommended clinical guidelines, and with meeting the standard of care. Currently, the NIHB program is not meeting the standard of care. And with that, I would like to introduce my colleague and co-chair of the Indigenous Chiropractic Caucus, Dr. David Peeace. Walaliyok ak umsik nogama.
Thank you, Dr. Ward, and good morning. As co-chairs of the Indigenous Chiropractic Caucus, we see every day how gaps in access to care affect Indigenous families and communities. For many Indigenous people, chronic pain is a daily reality, and this reality is one that can lead to addiction, mental health conditions, and financial insecurity. I think of my patients, and many have told me that traveling to care costs them hundreds of dollars, and many families just can't afford this. And their only option is medication or not seeking care at all. The federal government has recognized the importance of closing the gaps in Indigenous health. The Prime Minister's mandate letter calls for improved outcomes through culturally appropriate, community-led care. The Standing Committee on Indigenous and Northern Affairs has recommended reviewing NIHB coverage to identify gaps. Yet chiropractic services were removed from the coverage years ago, leaving communities without access to safe and effective care. By reinstating chiropractic under NIHB, the federal government takes tangible steps to advance reconciliation and health equity, reduce reliance on opioids, and ensure Indigenous communities have access to evidence-based, non-pharmaceutical, culturally appropriate, and guideline-driven musculoskeletal care. The patients we serve, the families we see, and the friends we have come to know and care for deserve access to care that allows them to live without pain, to work, and to participate fully in their communities. Restoring chiropractic care under NIHB would help make that possible. This is an urgent and actionable policy choice, one that can directly improve lives, reduce suffering, and strengthen communities. It's time to restore chiropractic care under NIHB for reconciliation, for health equity, and for the well-being of Indigenous communities across Canada. It's now my pleasure to welcome our CEO, Dr. Ayla Azad.
Thank you, Dr. Peeace, and thank you, Dr. Ward, Dr. Barron, for your powerful words and leadership. Today, we have heard clearly why reinstating chiropractic care under the NIHB program matters, not just as a policy change, but as a meaningful step toward reconciliation, health equity, and improved well-being for Indigenous communities across Canada. As the national voice for more than 8,000 chiropractors, the CCA knows the difference that timely access to care can make. Too many Canadians, particularly those in First Nations, Inuit, and Métis communities, still face significant barriers to accessing essential care. Expanding NIHB coverage to include chiropractic services is a practical, evidence-based solution, one that improves health outcomes, reduces reliance on medications, and empowers people to live free from pain. This is about real people and real communities, and the time to act is now. We are deeply grateful to our Indigenous colleagues and partners who continue to lead this work with courage and commitment. Your voices remind us that equitable access to care is not just a goal, it is an obligation we share. On behalf of the Canadian Chiropractic Association, I want to thank all of you for joining us today. Together, we can ensure that Indigenous communities have access to safe, effective, and the culturally grounded care they deserve. We would now be happy to take any questions.
No, thank you.
We don't have any question at the moment. Is there something you would like to add to your statement?
Just that we look forward to working with the government to improve health outcomes for all First Nations and Inuit people by reinstating chiropractic care to the NIHP program. Thank you.
Thank you. This concludes the press conference. Merci. C'est ce qui conclut cette conférence de presse.
Thank you.